Good evening, ladies and gentlemen, and welcome to another interview inside the Peace Project. And I am just going to give everyone a few minutes, just a chance to join us. And whilst we're doing that, I'm going to introduce you to Phyllis, Dr. Phyllis Chan, who's joining us this evening. And we're going to be having a really interesting conversation tonight around awakening, which is a theme inside the Peace Project this month. And Phyllis is going to share her journey, which is just amazing. So Phyllis and I, we met at probably the worst ever health and wellbeing fair, didn't we?
Oh, yes. You reminded me now. I've forgotten about it already.
So it was a really cold day, wasn't it? It was just before Christmas. Traffic was really pretty slow. But with all these things, when you go to an event like this, you always meet interesting people, and you and I met.
Yes.
And we had a great conversation. So I'm really excited to get you inside the Peace Project because I think you've got such an amazing story, and I'm really excited to not only share that, but just inspire people with your story. So tell me, what's your job now? What's your role?
Right.
Who?
So I'm a GP by trade. I'm still a GP. I work part-time, but when I say part-time, it's never part-time because you always be logging on at home and so on and so forth. But yeah, I work part-time Monday, Wednesday, and Friday as a GP. And Tuesday and Thursday and the weekend, I am a different role. I'm a Reiki master and I run retreats. Used to be every 2 months, just to kind of show people that medicine is important. You got high blood pressure, you need to take your tablet, for example. But there are other things that we need to do to help ourselves to heal. I'm not talking about the body, I'm talking about our mind and soul. So I
Mhm.
think medicine is great. People kind of think, oh, I've got always got a tablet for something. But actually, as a doctor, I realized that so many things can be treated by a tablet. It's not that simple. So I realized that other modalities are needed in order to help people to heal as a whole. Like we're talking about like heal holistically. And that's why I got into doing Reiki on a side business, and I'm building that.
Mm. So tell me, have you always been interested in Reiki? Is this something that's always been in parallel with your doctoring career?
Absolutely not. Okay. So the story goes like this. I was a partner in a surgery, and one of my work partners, and she was saying, "Oh yeah, I learned Reiki," and I'm like, "Look, do not even mention that at the surgery because this is alternative medicine that's not backed up by the NHS or it's not proven scientifically. So if you mention that to people, they go and have that done, and then something bad happen, then what will happen is we're gonna drag into it." I said, "Do not even mention it." And to me, at that point, 10 years ago, Reiki was my understanding was you just wave your hands just at the person and say something, and then whatever the symptoms go away, which is not logical. And I have my logical mind on, I'm thinking, no, that can't be. And then 10 years later, I completely changed my mind on Reiki because of an awakening story. So I might as well go into that then.
Mm.
So uh, being a partner of a surgery was really hard, and I think when you see people said, oh, GP have long lunch break because they only work morning and afternoon, and then they have the whole afternoon to have lunch, and then they go home at 6 o'clock and that's it. No, it is a job that you do 24/7. You cannot stop worrying about your patients. You constantly worry about them, so you'll be working late at night, on the weekend, and I think doing that for about 10 years, I started to burn out. And I know that I need to kind of do something about it. And one night when I was working late at home, about 11 o'clock, I remember it's October, really cold. And I just, I heard a voice and it said, Phil, go and find your tarot card. And I'm like, right, okay, I would do it, but why? Where's that voice coming from? I know that is not me. It's just a voice. And I said, okay, I'll go and find it. And that deck of tarot card, I had it since I was 18. I never used it, never ever used it. And it just looked pretty and it was on my bookshelf. So I immediately know where to look for it. I dug it out and I start reading the book and see how to read it. And I'm thinking, I need to kind of ask, what am I doing? What is my life purpose? Because I've always been asking myself, or talking to my husband about why are we here. You know, sometimes do you not think, why are we here? What is our role? Is that it? You know, am I gonna stuck in that surgery forever? And if you're telling me that yes, this is your role, then I'll stay. But if you're telling me that I need to go and do something else, I won't stay. So being a skeptic, you know, but also always been spiritual, but haven't actually looked into it because I didn't have time. I started to do a set of cards every day, asking the same kind of questions, similar theme. What am I doing? Should I leave? Is there something new waiting for me? And obviously all the cards are different, but the theme is the same. The theme is I have to leave in order to start something new. But once again, as you might know, although the cards keep on telling you that, your logical mind kicks in and said, "No, it can't be. It can't be." You know, it's just the card saying, does it actually mean anything? Logically speaking, I'm saying I can't really leave my surgery. I've got like 40 people that I hire. Can you imagine? I go in and tell them I'm going now. I'm gonna be gone in 6 months or so. You know, what will happen to my patients? What will happen to the surgery itself? And that is stopping me changing. And I thought about it for months. And eventually, after getting the same deck of cards, as in the same thing every time, I have to do something about it.
Mm.
And I handed my resignation and I never look back. And in fact, that even my husband, who's a skeptic, he said to me, "That's your best decision ever in your whole life."
Wow.
So that was phenomenal.
Mm. So this at this point, you're trusting the cards, you're doing the tarot. What happened next?
So I'm kind of thinking it's quite scary, isn't it? You sometimes it's the better the devil you know. You know that work is hard, but you've done it so many times, you do it day in, day out, you might as well stick with it.
Mhm.
Handing in the notice was a sigh of relief, actually. Make me feel, great, you know, a big weight off my shoulder. But what next? You know, you still have to eat, you know, you still have to live. And I had loads of people contacting me for jobs, you know, because everyone's looking for doctors. And they said, "Oh, I've got a job for you." And I'm like, "Oh, no, I'm gonna think about it. I'm gonna think about it." And then this whole, you know, synchronicity come through. So the card came on telling me something new is gonna happen, and you're gonna go on a new venture, doing something completely different. Obviously, being GP to me is not a new venture. And I was like just scrolling online one day, looking at Facebook, and Reiki came up. And it was a course in Brighton. And they said they've got spaces. In fact, I remember the line. They said, "Only 2 spaces available, so you better be quick." And that triggered me. And I remember the conversation that I had with that partner 10 years ago. And I'm thinking, something is telling me that I need to go and look into it. Even
Mm.
though I completely was a non-believer, I can tell you the day I paid for the ticket, paid for the course, the day that I went, I was still a non-believer. I just want to know what this is all about because now I have time in my hands, I can look. So I paid for the course, I turned up, and there were a small group of 6 people, I think including me, there were 6 with the teacher. And these some people already did Reiki before, and they said, "Wow, I can't believe it. You know, the energy. You know, I can feel the energy in my hand, you know," and they were like doing all these stuff. They said this energy is this big. I can feel it. And some people said, "No, mine's even bigger." And I thought, I made a big mistake. What am I doing? What am I doing? Because I never experienced this energy. And I'm thinking, I'm gonna have to spend 2 days with them, hardcore. I'm thinking, should I leave or should I just do one day and go? And then once you started the attunement, once you kind of start practicing, I suddenly click. I think I click on the second day. First day I went home, I'm still thinking, yeah, my husband said, "How did it go?" I'm like, okay. Second day, when you went deeper in the attunement, I suddenly felt exactly what they were talking about. And once again, it's something as you are a Reiki master, you will know. It's not something that you can explain to people. You're
Mm.
trying to explain to them, "Oh, I can feel an energy in my hand." It's so skeptic. People are skeptical, and understandably, I think people should be skeptical. Not until you try something, you have felt something. You shouldn't go and trust something so easily because people then get scammed. But
Mm.
that's what I said to people about Reiki, and I said, "Look, this is not something to replace medicine. Medicine has its place. But what Reiki does is tap into your subconsciousness, to tap into universal energy out there, so that you can heal, you can get into subconscious and see what exactly is going on and start working on the problem. And the energy is so phenomenal. And only if you felt it, you will understand. And people that actually had Reiki with me would understand exactly what I said to them. Because as you might know, people that go and do alternative therapy is because they've tried everything under
Mm.
conventional medicine and nothing works. Like cases like fibromyalgia, for example, there's no treatment. And the only treatment is in the past was graded exercise. So basically telling you need to know your limits. And if you do too much, you're going to pay back in the next few days. So you just better not overdo it. But still lots of people suffering from it. 10, 15 years, of symptoms, and they're just suffering. And initially they might go on to medication for pain. Initially it will work. And after a few years of being on this medication and the increment of the dose, things start to not to work.
Mm.
But then, as we both know, fibromyalgia is generally caused by trauma of a psychological thing or physical thing, or even COVID. COVID will be like a hot topic now, isn't it? Because quite a lot of people are suffering from similar symptoms to fibromyalgia, or a chronic pain syndrome, that kind of thing, chronic fatigue. These kind of things are caused by trauma, and COVID was the trauma. And what if we are able to help these people alongside medicine to help them to heal? Wouldn't that be great?
Mm. So you've gone along to this first Reiki course, and for those of you that aren't familiar with what Reiki is, it's a Japanese healing technique, Rei meaning spiritual and Ki meaning energy. So it's an energy healing practice. So it's probably as far as you can get from medical training. Uh,
Yes, yes, absolutely.
the complete opposite end of the spectrum. So I understand why you were initially cynical, and you're right, you do have to experience it. It's experiential. And one of the most profound impacts of Reiki is it's usually deeply relaxing.
Yes.
When we relax, the body can start to repair and it can start to heal. So you've done your initial training, and of course, that initial course is all about yourself, healing yourself, and maybe playing on friends and family. What happened to you after that initial course?
So obviously, was better person to test on, which is my husband. And I said to him, look, well, this is a new thing that I've learned. And he said to me, he's supportive. He's, a non-believer, but he said, go and do it. As long as you're not being too crazy, then that's fine. And that's the motto that I live by now. As long as it's not too crazy, it's okay. So I said, why don't I practice on you? Then you can tell me, because you can do self Reiki, which is what I've been doing for a while, and I felt the benefits, I feel the relaxation, and I feel I've got a clarity of mind. When you're in that meditative state, sometimes messages come through and you'll be like, oh, actually that's what I need to do for that matter. you know but I'm thinking, is it me that kind of thinking that it works? Let's try it on someone else. And I can tell you that was a complete fail. I chose the wrong day. It was a football day. I think there's a football match on. And the only thing that he was thinking about when I said imagine the energy ball spinning, what he could see was the football and thinking about the score. So that wasn't great. Then I'm kind of thinking, no, I really need to kind of find someone to do it. And I had I'm not going to expose who it was, but I had a friend who contacted me and said, well, look, I've been having this back pain issue for a long, long time. And I've had scans, I had seen orthopedic, I've had all treatment. Nothing works for me. But I heard that you've done Reiki, right? Because I posted on Facebook and said, I need guinea pigs
Mm.
to practice. And she said, why don't you come and practice? Because I've run out of options now. I need to do something. I was like, yeah, okay, I'll come, with actually no expectation in mind, because I really think it's a great thing for her to kind of believing in me to try something so out there. And I went to her house and we only did about half an hour session, not that long. And I remember when I saw her, she was like hobbling and she couldn't stand up straight and her back was curved. And then she opened the door and then we did the session, half an hour. She suddenly thought, I need to kind of stand up and have a walk around. She walked up and down the stairs. I remember that. And she said, the pain is gone. I'm like, how can that be? Because I wasn't expecting that at all. Then I started to kind of grew confidence and I'm thinking, you know what? When people I wouldn't go out to tell people at that point that I do Reiki and I think you should give it a try. But when people mention, I've tried so many things, doesn't work, and I'm thinking about alternative therapy, then I will home in and say, well, look, do you want to give that a try? And I have done treatment for people with depression, anxiety, chronic fatigue syndrome is a big thing. Quite a lot of people actually do suffer from that. Even to cancer treatment, they are having cancer treatment alongside, but it's the anxiety, it's the worry, isn't it? Because it's the unknown that kind of driving them feeling unwell and worry. And these are the kind of patients that I've been treating. And put it that way, they do still come back on a regular basis, which means that they must have had benefit in some way. Whether you might see some people who never try Reiki might say, ah, it's all psychological. That's fine. If actually that helps them psychologically and help them to feel better, I'm okay with that. I'm okay with that.
So, you're in your training, you're now practicing on people, you're getting some great results. What happened next in your career?
So when I decided, you know what, I have to kind of spread the words, and I realized with the card reading, I was still, I tap into spirituality way more, and I created groups. I created my Soul Serene Crystal and Reiki group. Initially, I was just making crystals. I literally was making wire wrapping because that's one way to keep me sane and, like a relaxation thing. But then you can only make so many pendants. You have to sell them, right? Because I build up at least about 20, 30 pendants in the house and they're sitting there because the wrapping process was therapeutic. But when you build up a bunch of pendants, you have to do something about it. And I decided to sell them. But then I charged them with Reiki and I sell them, saying, the crystal is great because you can work with crystal, like crystal therapy. They all have different vibrations. They all help you to heal in certain way. But what even better is to have the Reiki in. Then the group started to grow. And I'm thinking, actually, I understand what my life mission is. My life mission is to be a doctor, to understand medical problem, but also to put Reiki together. So East is meeting West together. Then that's what we're trying to achieve is to heal mind, body, and soul. So what's better way to, apart from providing one-to-one therapy, I decided to do retreat. And it's partially selfish because I want to try different things. We had that conversation before, and I said, if you go to a fair, like a spiritual fair, and you see loads of therapists there, it's quite hard. You have to be quite brave to kind of say, I'm gonna go and try Reiki, which you know nothing about. Are you okay to part your money? Substantial amount. It's not like £1 or £2. Are you happy to part your money to do something that you've never done before? Not necessarily. Because you worry about being con or maybe that's not my kind of thing. So with that in mind, because I could be that kind of person, other people would have thought the same way. So I decided to do like a half-day retreat every 2 months. So 2 till 5 on a Sunday. And the people who attend will be able to experience different modality of therapy. So initially I started with Pilates. I mean, who doesn't like Pilates? Is a physical exercise that makes you feel good and also put you in a state of mind of calmness, I think, with the breathing technique. And so I invited a friend who actually does Pilates. So she did the first session, and then I do a group Reiki session because I think people will feel braver to go and give that a try when loads of people are trying it, and then they can share idea, they can share experience. Because as you know, people that has done Reiki before, they all felt differently. They will all have different symptoms. Some people say, I literally feel pain coming out of my hands and now I'm fine. Some people cry a lot because that's their release. And it's a safe place to share and actually meet like-minded people. Because I can tell you there are lots of people that are interested in alternative therapy or tap into the spirituality. But if you go and tell people stuff like that and be too open, people will be like, whoa, no, thank you. Don't want to talk to you now. Because, that's not the norm. And this is the awakening. This is the awakening that we're talking about, realizing that there's potential to tap into universal energy, knowing that spirituality can help us grow our mind and see the world clearly, differently, help us to manage things differently. Awakening is a painful path, I think, because It's scary to change because, as I said, I could have stayed there for the next 20 years because I might tell myself, well, this is how it's like being a GP. You know, everyone's the same. They work long hours, so just deal with it, stick with it. But no, you have to listen to your heart. Your heart is telling you this is not right. So sometimes you have to kind of put your logical mind to a side and listen to your heart. And
Mm.
by doing meditation, you get messages. You
Mm.
get a clarity of mind. You then know what you need to do. And that's why I said it's really important to tap into your spirituality,
Mm.
connect with your spiritual guides, get guidance, get your quiet 5, 10 minutes. I said to people who said to me, I never have time to meditate. Yes, you have. You don't need to do it long. 5 minutes, right? 5, 10 minutes a day. And just sit there quietly, pay attention to your surrounding, just feel, be mindful.
Mm.
And then suddenly everything become calmer, become clearer, and you know what to do. Um, but you have to take the leap of faith. When people said, "Oh, I don't know what to do. I really want to do that, but I'm too scared." This is the moment that you have to make the decision
Mm.
and do what you want, do what your heart desire, because we're not here for too many years. You think that, oh, I'll live to 80s. Well, I'm looking at the clock now. I'm halfway to 80. I'm halfway there. So it's not much time left for me to do what I want. And
Mm.
that's why I'm doing what I want now.
So now you're a combination, you're a GP that also is a Reiki master. How does that work when you're seeing your patients as a GP? How do you fuse the
Yeah.
two?
It's difficult because as an NHS doctor, I would never mention Reiki in a clinical setting because I just don't think it's a conflict of interest. Especially, I would definitely not to say booking with me. I won't. But let's say I had patient that come in and said, "Well, look, this chronic pain been going on for so long. I've tried everything, and in fact, I remember trying acupuncture, and that really worked for me. I wonder if there's any other alternative therapy out there." And I said, "Well, look, there are many alternative therapy out there. You can look into it. Then there are websites to show you what are a list of alternative therapy. Then you can discuss with them and say, why don't you try this and that? Potentially you can look into it." And I'm open-minded. And when I express to them that, oh, I know what you're talking about, like cupping, for example, like Chinese medicine cupping, and
Yeah.
they're like the whole idea is to sucking out all the toxin through that cup. And I know people that does it. And when they told me, they said, I don't want to tell people because they think that I'm weird, but I do this. I was like, yeah, do it, do
Mm.
it. Acupuncture, great, because it's working with the Chinese meridian,
Mm.
and meridian is all about chi. In fact, Reiki is about chi. In fact, all these alternative therapies all have the same common theme to me. It's all about balance, balance of the chakra, balance of these nerve points. And when everything is in balance, you feel great.
Yeah.
So these people are like, oh, I'm so glad that you're so open-minded about alternative therapy. I told some GPs before and they just shut me down straight away. Be open-minded is a key thing to awakening.
Mm.
Trying new things is a key thing of awakening. And not to get scared is a key thing about awakening. Because you don't take that leap of faith, you never get to where you want to go to.
Yeah, and I can totally relate to your journey about like having to make that really brave decision. I've made multiple brave decisions in my life, and I know there's some people watching this live tonight, and I'm sure they can think of a time when they made a really courageous decision that, like you say, logically didn't make sense, but they
Yeah.
just got this inner pull towards to move towards it, and it doesn't stop, does it? Once you've gone through an
Yeah.
awakening experience, you're forever growing and challenging in that way. So what does the future hold for you?
So I'm still building the Reiki side of thing. My mission, it sounds like such a big thing, but it is a big thing, is eventually combining medicine with Reiki together, but is in a private setting because I know I can never do that under NHS. Yeah. So my key motto is this: if I tell you to take a tablet, you probably need it. I would never say do Reiki, everything can be healed by Reiki. No, no one thing can heal everything. But in combination, things work really well. So I'm hoping my next 10 years plan would be build up my own clientele and then treat, like, for example, a patient will come to me and see medical problem and I deal with them. But I also said, I've got an umbrella of therapists that I can identify. I think you might benefit from, for example, acupuncture or reflexology, that I can introduce you to them. So you can treat the person holistically, which
Mm.
is unfortunate that we have to do it in a private setting. And I'm just hoping that NHS would be more open-minded to fund, alternative therapy and non-conventional stuff, because I feel that quite a lot of things are caused by mental health or
Mm.
worsened by mental health. And in fact, this is the area that I feel has the least funding. And by preventing people having mental health issue, by helping them to relax, by helping them to heal mind and soul, I think quite a lot of our physical problem wouldn't be there or wouldn't be as bad.
Mm.
So that's my mission in the next 10 years, and I'm hoping to see that grow.
Mm. And I think that's incredibly exciting. I think there's probably a lot of people watching this video now just wishing you were their GP. Because, you're right, it's about finding, and it is changing. Like people's views and attitudes around Reiki and spirituality is changing. I've noticed a shift. But, when
Yes.
I had chronic fatigue back in the 90s and the early noughties, I just got blank stares. Like you say, they have no treatment for it. And that's why I went off on that alternative path. Wouldn't it have been great if I could have gone to somebody and they would have done the legwork for me and saying, try this practitioner, try that avenue, and
Yeah.
somebody you come back to and share that journey with. So I think it's incredibly exciting. I think your 10-year plan is fantastic. And I do hope that the NHS, which does seem to be waking up to things like reflexology and
Yeah.
Reiki and meditation, and being outside in nature, there is a shift, a little slow for my liking, but at least it's happening. So yeah, we'll watch this space. Well, I'm going to wrap this up for tonight, but thank you so much, Phyllis, for talking to us. And
No, thank you for having me. I just think people need to know there's way more things out there. Awaken yourself, listen to your heart, tap into your spirituality, and seek the answer that you really need.
yeah, well, let's you and me keep going and paving the way for others to
Yeah.
and go on that journey. It's just been a real delight to talk to you, and I look forward to catching up with you soon.
Yeah, take care.
All right.